Hello, everyone, and welcome to Lakewood Health System's Be Well Videocast. My name is Matt Jensen, Director of Marketing at Lakewood. Today, our focus is women's health and looking specifically at the topic of medically supervised weight loss. What is it? How does it vary from other programs and other plans that are out there today? And how you might want to get started with a plan at Lakewood if this is something that might be right for you. So here with me today to talk about this are a couple of women's health experts at Lakewood. Dr. Mary Holm, she's an OBGYN here at Lakewood, and also Kelly VanVickle, certified nurse practitioner at Lakewood. Ladies, thank you so much for joining me today. It's great to have you with me.
Thanks. It's great to be here today, Matt.
Hi, Matt. Thanks for having us.
Yeah, great to have you with me. Dr. Holm, first question, I'd like to start with you. So in today's world, we are inundated with marketing and messaging surrounding weight loss. Keto, Atkins, protein powders, low carb, appetite suppressant, the list just kind of goes on. And quite frankly, it can be overwhelming, I think, to a lot of people. Unfortunately, I think it also seems that women unfairly bear a lot of the brunt of the pressure to look a certain way or maybe maintain a healthy body weight. But one option that may not be at the forefront of women's minds is actually working with a healthcare professional like yourself to lose weight. Can you tell us a little bit about this? What is the basic concept and why might this be a good alternative for some women who might be interested in it?
Sure, Matt. Medical bariatrics is the science of losing weight through a medically supervised program. So this involves dietary and activity counseling, possibly addressing behavioral disorders that as they relate to weight concerns. In some cases, our weight loss program also involves use of medications. Our department does not do anything surgically for weight loss. And in our department, we see female patients only. As compared to other programs, Kelly and I do not feel that this is a one plan or one size fits all program. Patients fill out an exhaustive, thorough survey that addresses their eating and their activity lifestyles. It talks about family interaction as it deals with meal preparation and eating meals together, what happens when they eat out and how that's incorporated into their lifestyle, and also grocery shopping and who does that in the family. This allows us to tailor the program to each individual. As part of this, sometimes we have to have them come in before our first session and do some additional blood work.
Thank you, Dr. Holm. Great information. So just to clarify again, you touched on this a little bit. So I think sometimes when you hear the phrase medical supervised weight loss, you may think of a procedure like a bariatric surgery or something like that, or also maybe some medication of some sort. Could you clarify that a little bit just to make sure we have a good understanding of that?
Certainly, Matt. Initially, we start with behavioral, dietary, and activity changes, but as you alluded to, we do use medications. Some of these medications may have to do with appetite control. Some of them have to do with lowering their insulin level, and others may have to do with food craving control. Sometimes as part of that, depending on what medications they use, some additional blood work may need to be done, or an EKG may need to be done beforehand. But we do not use any surgical interventions to decrease the size of the stomach or anything in our department. All along the process, we are encouraging patients to actively give us their input on how they feel it's going so that we can tailor the program to their needs.
All right, and through the magic of editing, Kelly is next up, and my next question is her. Kelly, this one's for you. We know there are so many benefits to achieving and maintaining a healthy body weight. Can you talk a little bit more about this and also perhaps give us some of the reasons why a medical weight loss program like the one at Lakewood might be a great option for someone?
Sure, Matt. When it comes to the benefits of obtaining and maintaining a healthy body weight, there's the reasons that we hear of most commonly, like decreasing risk for heart disease and keeping a healthy blood pressure, decreasing our risk for getting diabetes. But there's also other reasons that we may not be as familiar with. Maintaining a healthy body weight also can decrease our risk for getting certain cancers like endometrial cancer, breast cancer, colon cancer. And I think that's a pretty cool thing that we can give that control back to patients in order to reduce their risk of getting cancer. There's also other reasons can help decrease risk for liver disease or something called non-alcoholic fatty liver disease, which is similar to what alcohol can do to the liver, causes damage and how that liver is able to function. A healthy body weight also can improve the quality of sleep that we get and decrease the risk for getting something called obstructive sleep apnea. An area that I work commonly with is fertility, and a healthy body weight is very important when it comes to improving fertility and also improving the chances of having a healthy pregnancy. A normal body weight is important to help the ovaries function, which is priority number one when it comes to getting pregnant. And then when it comes to pregnancy, a woman at a healthy body weight has a lower risk of having a miscarriage, a lower risk of developing issues during pregnancy with blood pressure and with diabetes. So it's very important when it comes to fertility. And there's also some research showing that a mom's weight, if she's obese during pregnancy, that there actually can be some long-term implications on her child and the child's adult life as far as increasing risk for things like diabetes. So those are kind of the physical things, but there's also emotional benefits when it comes to a healthy body weight. We know it can improve energy, it improves self-esteem. When we look good, we feel good. So it can help with mood, improve anxiety, depression. So I think those are pretty key benefits. When it comes to what makes Lakewood different, or where I think benefits Christine, Dr. Holm, and myself, we really take the approach that food is fuel, and it can either be toxic or it can be energizing, and just really trying to get an understanding of where the patient and her family is at and how we can help identify any barriers as to what we need to overcome to help her with weight loss. We focus a lot on education, and we may bring in other team members in order to do that. We think that's helpful with that too. But we're really just here to support. I've been afraid of getting on that scale when I have to come into the doctor's office, and I really try to stress that it's not just a number on the scale that we're looking at.
So really, Kelly, so many reasons to be aware of your body weight and try to keep that in that healthy range. Again, for fertility, obviously that's something I know you work very, very closely with as well too. So thank you for sharing those reasons. So tell us a little bit more. What could a woman expect starting this program? What would an initial consultation look like? Maybe walk us through just what that road looks like to get started and to get this program underway.
Sure, Matt. So one of the first steps would be starting with their primary care provider and getting a referral to our medical bariatrics program here. And then, as Dr. Holm touched on earlier, we may have you get some blood work done ahead of the appointment, so we have those results to go through with you. Often a packet of information will be sent out so that the woman is able to answer a lot of those questions that Dr. Holm had referred to, as far as who does the grocery shopping and what is her lifestyle like. And then the first visit is really just a visit to kind of go through that information and get to know the woman, possibly go over those test results if we have those ahead of time, and really identify what her road has been to us so far, what any roadblocks have been, where her concerns are, and then working with her to come up with a plan on, is it a large piece of education that we need to do? Do we help with giving meal planning ideas? Or one thing that I love that Dr. Holm does is uses eat this, not that. So some common foods that we may go to, but what to use in place of that. And I think that's
All right, thank you, Kelly. And then also through the magic of editing, Dr. Holm is back. As you can tell, we're doing our safe social distancing practicing today. Very important for all of us here at the healthcare facility. So Dr. Holm, Kelly touched a little bit on it. First step really is to sit down with that primary care provider and get that initial conversation started, and then looking for potential referral to someone like you or Kelly as well. If there's someone out there right now that's maybe a little bit apprehensive, they've tried other programs, they're maybe a little bit anxious about giving you a call, is there anything you'd like to share with them before we sign off for today?
Yes, Matt, thank you. The first step would be to get a referral to our Department for Medical Bariatrics from your primary care provider. That allows us then to look through your chart, see what additional labs might need to be done, and we'd contact you about that. For anybody that was apprehensive, I think we always are all afraid to step on the scale, and we've been there. I've had to worry about my weight at different times in my life, and it's very empowering to take control of your weight and take care of your medical course through life with good nutrition, with good exercise, and a healthy weight lifestyle.
Great information. Thank you so much. And again, if you would like to schedule an appointment with one of our primary care providers, you can go online and schedule that appointment, or you can give us a call at 218-894-1515. Dr. Holm and Kelly, thank you so much for being with me today. Have a wonderful rest of your day.
Thank you. It's been our pleasure.
Thanks, Matt.